Hello? Hello? Hello?
I guess you were all missing me there. I was talking away and you couldn't hear me. Thanks for that. Hi guys, Dave Johnson here again. So we want to jump right in and get started with today's Telehealth Learning Collaborative. We have Joan Sicard and Rayanne Aguilera on the line today, and Joan is limited in terms of time, so I wanted to get right to her to share an update for us. So Joan, take it away.
Okay, can you hear me?
Yes, we can.
Okay, good. Good. Hi, everybody. I do have another meeting, another call I have to jump on to, so I asked if I could go first. I know people have been asking for a copy of the most updated regulation. We've been working with our counsel's office, and counsel feels that the statute appears to be self-implementing. So we think we're going to go with the statute, and we're going to put out a Medicaid update, which has been prepared, and it's sort of going through channels here at DOH, and then it'll go over to our Division of Legal Affairs, and it'll circulate around here, and then it'll be put out. There won't be the waiting period of 45 days while it goes into the state register like a regulation would. We do have SPAs in place for remote patient monitoring and store and forward. We're broadening them a little bit. And so we're resubmitting them on the advice of counsel just to add in just a little bit more so that they are perfectly mirroring the statute.
Okay.
That's about it. Any questions?
Yeah, that's quite a bit different, Joan, than what we were thinking. So could you explain a little bit more? So it's what was the phrase you used?
Self-implementing.
Okay.
The regulation was going to mirror the statute, and every time a change was made to that regulation, we would have to go put it out in the state register for 45 days, and this is a much quicker way. The regulation was exactly like the statute, and we have added in practitioners. There is no limitation in where they can practice because that's what the statute says.
Okay.
You know, so we're going strictly by the statute.
So you're saying there's really no regulation around the statute? Is that
right? It's that we've been told by counsel that it's pretty much self-implementing.
Okay.
And we don't need I mean, it's a choice. We don't need regulations.
Well, to me, that sounds like a positive result. Any thoughts or questions from folks on the line here? We got, let's see, whose hands have raised. Oh, you know what, folks? I might have just put everybody's hand down who was going to ask a question, but if you could do that again for me, that'd be great. I see Lowell Feldman. Lowell, you're on the line. Go ahead.
Okay, hi, and hello, Joan. We met a while ago in Albany with the Castleton Group. So, in accordance with the statute, where does the actually physical location of the practitioner have to be? Is it still a requirement for the doctor to be in his office, or not necessarily anymore?
For the, I'm going to have to pull out a copy of the regulation here, but 1 second. Give me a second. I think it just says the distance site is the location where the, wait a minute.
That's one of the key questions, Joan, so take your time and finding that.
Yeah, this won't take more than a second.
Maybe recirculate the statute as it is.
Yeah, I could certainly put that on our website too. But go ahead, Joan.
Okay, let me just see here. Okay. I have a terrible echo on my end.
I'm sorry about that. We can hear you loud and clear here.
Good. Okay. The statute defines the originating site, and that's where the patient is located at the time the services are delivered, and that's where they restrict it to an Article 28 and Article 40 facilities defined under Article or Subdivision 6 of Section 103 of Mental Hygiene Law, a private physician's office located within New York State, and when the patient is receiving health care services by means of remote patient monitoring, the patient's place of residence located within the state of New York or other temporary location located within or outside of New York State. That's when they're getting remote patient monitoring.
Mm-hmm.
And let me see. I'm looking for the actual language for the distance site. It's just a very short sentence.
Yeah, isn't it, Jonas, doesn't it say something just like it's where the physician is located?
Yes, that's
basically.
I wanted to read it to you, but it let's see. I apologize. I just came from another meeting that I had to hurry out of to get here, and
Well, we can put the statute out again, Joan. Yep.
We can put the statute out again, and that's basically what it says is that it's the place, the distant site is where the telehealth provider is located while delivering healthcare services by means of telehealth. That's the sentence.
Great.
So there is no restriction on the telehealth provider. And of course, wherever they are, the services provided have to be secure, encrypted, all of that.
Right. Yep. So as long as the session, the patient encounter is HIPAA compliant, secure, and encrypted, I think we're good to go there. So
right.
Averill George is shouting hallelujah on that one. So Averill, if you could just send or enter your audio pin, then I could unmute your line so we could enjoy that hallelujah with you. David Colarusso, David has a comment here, Joan. He says, do the regs list what kind of practitioners are to be considered to provide care or interventions?
Yes, they do. There's a very extensive list. Yes. And they list, these are all pursuant to education law, if it applies. Physician, physician assistant, dentist, nurse practitioner, a registered professional nurse, but that's only for
remote patient
receiving patient-specific health information or medical data, right, at a distant site through remote patient monitoring. A podiatrist is included, an optometrist, a psychologist, a social worker, a speech-language pathologist or audiologist, a midwife, certified diabetes educator, and there's all the certifications that they have to have, a certified asthma educator, and again, there's specific certifications, a genetic counselor, and there's specific national certifications, and then they go into like some of the sites that would be a hospital, a home care services agency, a hospice.
Okay. Great.
So yeah, so it's a very extensive list.
Mm-hmm.
And
Excellent.
actually, it's not in the original, I should say this. A physical and occupational therapist has also been added.
That's right.
There was legislation passed in July. So I'm looking at the January, the original one, and that came after. So those are also included in the list of practitioners.
Yep. Great. Let's see, any other questions for Joan? We've got another comment here on the line, but it looks related to something else, and I don't want to keep you too long there, Joan.
Okay.
Any other questions or comments? I'm looking for hands or questions. Andrew Solomon. Andrew, go ahead.
Can you hear me?
Yes, we can, Andrew.
Perfect. Joan, one of the questions that has come up to us, I'm with the Northeast Telehealth Resource Center, and we had a question from an attorney. His name is Nate Laxman. He's very involved in the telehealth community, and he was wondering, and I don't know if you'd have an answer to this, but he was looking at the structure of New York State public health law, and he thought it's potential that this regulation doesn't just apply to Medicaid reimbursement, but it might apply to all telehealth practice in the state, which would mean anybody providing telehealth, if you're doing it out of pocket to a patient's home, you would need to follow these regulations, which means you could not see a patient in their home, even if unrelated to Medicaid reimbursement.
Well, it is parity law for the state. Rayanne, can you speak to that?
Sure. Am I off mute?
Yes, you are, Ryan. We can hear you fine.
Great. So receiving services in the home is allowed. This particular statute is specific to Medicaid reimbursement. So on the commercial side, someone could be in their home, and if the commercial payer chose to pay for a telemedicine visit for them, that would be perfectly fine. I think this is just saying that with regard to Medicaid reimbursement, a patient, if they're located in the home, can only receive the remote patient monitoring type of telehealth. The other modalities, like telemedicine, which is what's most commonly requested, is not guaranteed to be reimbursed.
Right. I think it's that, this is the basics. This is what Medicaid is following. But if an insurer wanted to go above and beyond and reimburse for it, they most certainly could.
So it's not a limitation on practice. It's just around the reimbursement.
Right.
Right. Okay. Other questions? Let's see here. I think, Katie, did you have a comment or question? Oh, there you go. Go ahead, Katie. I'm sorry.
My comment was more along the lines of if a provider could practice telemedicine in his home, but that seems to have been answered, and that's really exciting. So thank you for that update.
Yeah.
And my next question was, I see that there's no 45-day waiting period. So do you have any sort of timeline on when this statute is going to be put into place?
I think going this route, it's going to be quicker because with the 45 days, after we got all of the comments in, we would have to go through those, and if changes were made, it's my understanding that it would then have to go back out for 30 more days. This could have been now. The Medicaid update is written. It pretty much reflects the statute, and it also has reimbursement information, fee-for-service. It's circulating here in our area among executive staff. once it is, it's been edited and it's all set, we will have managed care add a small piece regarding payment by the plans, and then it's going to go to legal and a few other places, but once it's agreed upon and edited, it will be published. So it depends on how long. Right now we're getting over the budget and all of that. People have been really busy, so things have been sort of not moving as quickly as they normally would because people have been so busy. But I think it's going to start moving quicker now. So it's my hope that, by the beginning of the summer, by June, this should be out. Maybe sooner, but that's what I'm hoping. It's written. It's 8 pages. It's long. The other thing that we still are, there is still a regulation for Radiology. And there was a regulation that was previously in place. It was 533.6, and it sort of broke. They wanted radiology. They wanted a radiologist to see the patient and examine them before doing a radiology procedure. We separated that into interventional radiology and diagnostic radiology in the updated regulation, because if you come in for a chest x-ray typically or a CAT scan, you may not see the radiologist. If you come in for interventional radiology where you're going to be marked for you're coming in for radiation therapy, you have breast cancer and they mark you, you are going to see the radiologist. So we separated those out. And the diagnostic radiology, you no longer need what our old regulation said. It makes it a little bit more streamlined. It allows for teleradiology. So that is still going to go through the regulation process and be posted.
Okay.
So we've pulled out telehealth. There's not going to be a regulation. Teleradiology will still go forward.
Okay. Actually, Averill George, your line is unmuted.
Well, I just have to say that I'm very optimistic right now. Very proud. This is wonderful. This is a lot of progress, and we're leading the nation right now. So congrats to everybody.
Good.
I knew
Thanks.
You'd be excited about that.
No, that it's taken a while, but yes. So we're good with that.
Yep.
Any other
Joan,
questions? I'm going to jump off.
Any timeline for the radiology regs? Do you have a sense about that?
No.
Okay.
No, I don't know. That's going to have to go into the Federal Register for the 45 days. It's pretty straightforward. It's short. Okay. And there haven't been a lot of edits to the draft regulation, so I think people will be satisfied with it, and if there are questions, there'll be few.
Great. Well, thanks for jumping on this call today, Joan, and really appreciate your input on that. Rayanne, I think Rayanne is going to stay on the line in case there's some follow-up. But
yes.
So thank you, Joan. Really appreciate it.
Okay, you're very welcome. Take care. Bye.
Bye-bye now.
Bye-bye.
Well, that's just phenomenal news. Great news, I think. Good to hear. Cindy Gordon did have a comment here. So, yeah, Cindy, I'm going to just unmute your line there for a minute. The restrictions for OMH are still there. So this doesn't apply to OMH. So where the provider is located is going to be different for practitioners from an OMH regulated site or presenting site from an OMH Article 31 clinic. So
yep, that's true. I mean, I don't have anything else to say but that. Just constant reminder.
Yep. Yeah. So maybe OMH will catch up. I think they will. We'll see.
You can only hope.
Well, that's just great news. If there are other kind of comments and thoughts, I wasn't prepared for that kind of news. so I'm still kind of absorbing that, and I imagine you guys are all going to absorb that feedback. So if you have other questions that come up related to that news, please let us know, and we can forward them on. Our kind of typical approach is to have somebody from OMH on the line, and we're also trying to work with some folks from OASIS to be a part of the group. Neither of those could be a part of today's broadcast, but we'll make sure that next month they're on the line with us. And we should also have a presenter. You know, typically we have kind of a featured presentation from somebody on the line and related to different projects that are happening across New York State, related to things that are kind of happening in your area. So if you're interested in sharing some thoughts on that, we're, look for a time on the calendar to let you get in on that opportunity. But just send your feedback to me or to Katie, and we'll be sure to get that information out there. I think that is all, unless somebody else has another question or comment.
David, I have a few announcements if you have time.
Oh, Ryan, yeah. You know what? And there's another one after that, so go ahead, Ryan.
Okay. Just wanted to speak a bit to the comment about OMH and let folks know that another activity that the department is engaged in is having regular meetings with OMH and OASIS. And we just today brought in OPWDD for some very regular meetings to discuss some of the issues about telehealth and working across the different sites and trying to reconcile the various guidance and regulations and statutes that apply to telehealth, or at OMH it's mostly telepsych, and with OASIS they call it telepractice. So I do want to try to assure people that that work is happening. It's pretty slow going because it gets very complicated with the various rules and regulations, but we're really hoping to bring some of those to light and try to figure out how to where we can maybe make sure that regulations are in alignment, or make sure that our guidance mirrors each other, or how we provide billing guidance for providers who may be operating across those types of sites. So, hopefully we'll be able to make some progress there and have things a little better aligned.
Good. That's great news. Rayanne, did you want to say something too about the Project Echo?
Oh, sure.
Yeah.
Yeah, just to make mention that the Project Echo Model Expansion RFA, it was released in late March, and there was a question period which has since expired. I think questions were due April 7th. We anticipate having questions, or the answers to those questions, posted by the end of this week, and applications are due May 5th. So I can't really answer a lot of questions right now since it is an open procurement, but if there are basic questions about eligibility, I can answer those on this call.
Okay. Any questions for Rayanne? I'm not seeing any, Rayanne.
Okay.
So that's good news. Before I let everybody go, let me just open up Andrew Solomon's line. Andrew, do you want to give a special announcement?
Yeah, sure. So just very briefly, I'll mention to everybody, if folks aren't aware, we're hosting our Northeast Regional Conference on May 23 and 24 at UMass Amherst. We start on the 23rd with a series of afternoon workshops with topics on legal and regulatory issues in telehealth, applications in store and forward, a hands-on technology lab with our partners at the National Telehealth Technology Assessment Center, and then also a workshop on business models for health systems and healthcare providers. We also have an evening networking reception on the 23rd, and then the 24th, May 24th, will be a full-day conference with a couple of really exciting plenary speakers, a number of breakouts, including Dave and Katie to present their 12 steps to getting started. So if folks are interested in learning more, feel free to contact me, or you can visit our website, netrc.org/conference.
Excellent. Great. Thank you, Andrew. And I'm sure that many of you are going to be attending the ATA conference that's coming up here shortly as well. So, next month when we're together, I'm kind of expecting that there might be some time on our agenda to kind of hear what people are saying as a follow-up to both at least to the ATA conference. So be thinking about bringing back some material for us to talk about on the Learning Collaborative.
David, this is Katie.
Yeah.
I will be obviously at the ATA, so if anybody's attending, feel free to reach out to me ahead of time so that we can connect and meet, and I will certainly be bringing back some takeaways to share at the next Learning Collaborative with obviously a period for comments and questions. And I wanted to throw one more thing out there. The North Country Telemedicine Conference that David and I put on, we have a save the date for November 2nd. It's a Thursday, and that's going to be at the Crown Plaza in Lake Placid, New York. So it's a ways away, but I just want people to have that on their minds. We are looking for presenters, so if anybody has any speaker ideas, feel free to send those my way or David's way.
Great, Katie. Thank you.
You're
Hey,
welcome.
Andrew, last year at the ATA conference, the NERTC put a little gathering together for the Northeast. Are you planning on doing that again?
We haven't actually dug into that yet. I unfortunately won't be able to attend. Danielle will be there, and David, if you want to chat about that, Danielle and I can talk about it, and we can see what we can do.
Yeah, I actually won't be there as well, but Katie will, and I know that was kind of neat to gather. I think it was in LA, right? And so just kind of the Northeast people. That was kind of neat to do. So just a thought.
Yeah, I think that I'll follow up with Katie and Danielle and see, and we can send out information if we can get something together. And David, I know we've talked about this, but maybe I'll put a plug in for it as well. We've also been exploring with you and some others the idea of creating the Northeast Telehealth Leadership Forum, which would be similar to the Learning Collaborative for New York, but will kind of extend across the region to connect folks, telehealth program managers, directors, really anybody interested in joining the conversation for the region. And as part of that, I certainly anticipate we'll be looking at, bringing these networking opportunities to these other events like ATA.
Great. Thanks. Well, thank you, everyone. I'm going to give you the rest of your day back and look forward to seeing you guys next month. Thank you, everyone.
Yes, thank you, everyone.
Thank you.